the key roles that testosterone and estrogen play in things related to whether it's energy, vitality, basically the way we feel.
What is age appropriate testosterone levels? I mean, my testosterone levels were in the 200s, which is fairly low, and I train with professional athletes still.
It doesn't matter how clean I eat. It doesn't matter how much I exercise. It's not only that nothing's working, it's getting worse. I'm putting on weight. I feel bloated. I don't feel like I'm in my body.
I also like telling the community about this because I want them to go and ask their doctor, hey, I'm not sleeping well. What do you think is going on? And then maybe their hormones can be investigated to see what's happening.
I'm Rich Dorment, editorial director of Men's Health and Women's Health, and welcome to The Future You, our show about the new frontiers of health, longevity, and building longer, stronger lives. Lately, my body and mind have been acting up. My workouts take longer to recover from, my pants are mysteriously shrinking, and I've developed a 3 a.m. date with my living room ceiling. I figured it was just stress or aging or drinking or eating too much, but it's more than that. We're talking about hormone change. It's a biological shift that can affect our mood, our memory, our sleep, our sex lives, our muscles, our bones, basically every part of who we are. Today, we're going to be joined by two amazing guests, Hollywood action star Frank Grillo, bestselling author Mel Robbins, along with Dr. Priya Jaisinghani from NYU Langone Health. And we're going to be talking about ways that you can identify what's happening in your body and thrive with all the changes. Welcome, everybody. Today we're joined by Frank Grillo, actor who's been in some small independent films like the Captain America series, this summer Superman. You're going to be in the second season of Peacemaker coming up. Basically, for the last few decades, you've been in action spectacles, martial arts sequences, and just nothing but ass kicking and name calling. But today we're going to be talking about you and your personal health.
Great.
So first of all, have you always been an active and energetic guy? Has that always been something that has been a part of your life?
Yes. I mean, since I can remember, I've always been conscious of what I ate, how much I ate.
Like 8 years old, you're conscious of this?
Probably sooner than that.
Really?
Yeah, it was a problem for my parents, my Italian parents. For a while, I would just eat almonds and raisins. And
you were an almond mom back in the late 60s?
Yeah, in the 70s, yeah. I mean, to this day, I don't like if I ever feel full. And I think now, when you kind of read about health and the body, I think we lean more towards the emptier you are, the healthier you kind of stay. So I train empty in the mornings and I eat once a day. And these are things that have carried over from when I was a kid. And I was a wrestler and
boxer
and
Jiu-jitsu.
martial artist. Yeah, so I was always weight conscious, cutting weight and stuff. Food was kind of the enemy. It's not about aging, it's about lifestyle. It really is. And so I see men that are my age and I'm like, wow. That's
good or bad?
Bad, and then
well, it's not good or bad. When we talk about hormone levels and things like that, there's like say testosterone. There's high testosterone, low testosterone. What about age appropriate low testosterone levels?
Yeah,
right?
I mean, but what is age appropriate testosterone levels? I mean, my testosterone levels were in the 200s, which is fairly low, and I train with professional athletes still.
Yeah,
and so recovery is a big issue. I mean, your health. Your health depends on the recovery, on your rest, and I was finding it harder and harder.
So hold on. So you grew up doing all these really intense sports,
motocross,
stuff that requires a ton of energy, a
Yes.
ton of discipline, a ton of focus. How much did that shape your identity, your self-identity, the way you thought of yourself and the way you presented yourself to the world?
I mean, I imagine it was everything. I mean, I'm a physical guy. I'm an aggressive guy. And when I say aggressive, I don't mean aggressive towards, my kids. I mean, I approach things in an aggressive manner. When I played sports, I played aggressively. When I ride motorcycles, I ride them aggressively. I've always been that way. I'm aggressive. I'm an aggressive athlete.
Yep.
It is part of my identity.
Yeah.
It is my identity.
And then there's like the job, right? Like
Yeah.
this is part of what you do.
Yeah.
As an actor who-
Which that never kind of happened until I was in my 40s and I did a film called Warrior.
Sure.
With Tom Hardy. And
MMA movie. If you haven't seen it, you
it's
gotta
got a
see
great
it.
cult following now. It's just
Sobbing at the end.
Yes.
Sobbing.
But that movie combined my kind of martial arts background with acting. And it's when people took notice to what I was doing.
Yep.
And that kind of took me on a journey that I wasn't expecting in the middle age of my life.
But you were able to do it, right?
Oh,
You
yeah,
were
I mean,
able to show up in 12, 14, 16 hours a day.
100%. 100%.
So tell me about when that started to change a little bit, when you first started to feel like the whole body isn't doing what it's supposed to do.
I want to say not that long ago, but I want to say at about 53, 4, 5.
And you're 60 now, correct?
60. I just turned 60.
We're gonna have to fact check that.
No,
But-
I just turned 60. It's hard to say that.
Thriving.
thriving.
Yeah.
Thriving.
I started to feel the pain in my joints.
Mm-hmm.
I started to feel there was problems getting a quality good night's sleep. I started to feel that my recovery, my muscles were not recovering the way they were when I was younger. And overall fatigue was kind of catching up to me. And yeah, and then I went to get tested. I had my
Right.
blood
But even
done.
before that, like, was there a sense of like resignation? Was this like, this is just getting older?
No.
This is no. You're like,
no.
this is not normal. I'm
I'm
do
not
something
going
about it.
this way.
Yeah,
I'm
yeah,
not, and listen, I'll digress for a second. I work with, I'm on a show called Tulsa King with Sly Stallone, 79 years old. And this guy is a phenom
Yeah.
when it comes to, his training and his eating and he still approaches life like in a childlike manner. And, I often say it's not age, it's lifestyle.
Yeah.
It's lifestyle.
Yeah.
And so, yeah, I was like, okay, I got to adjust.
Okay.
So my body is feeling it.
Mm-hmm.
I've abused my body for 30 something years. What can I do now
Yeah.
that science has proven that is going to help me on my journey?
Right. Okay. So Dr. Jaisinghani, let's take a step back. And,
Yeah.
when we look at what's happening in Frank sort of over time, but also in the last 5 or 6 years, can you talk a little bit about the key roles that testosterone and estrogen play in things related to whether it's energy, vitality, basically how the way we feel?
Yeah. So testosterone is primarily known as the primary male hormone, primary sex male hormone, and estrogen is known as the primary female hormone. Now, they both are important in both sexes.
Right. Everybody has both.
Yes, they're both important in both sexes. Testosterone is primarily functioning to maintain your bone density, your muscle mass, your mood, your motivation, your energy, body hair, even
like-
your red blood cell
Yeah.
production.
The guy
right?
stuff, right?
The guy stuff. But it's also important in females.
Yeah.
Estrogen also plays a very similar role when it comes to mood, motivation, hair, skin, muscle, bone. So it also plays an important role. Now, Frank, you mentioned some really crucial things that I have to cycle back to. So one thing you mentioned is that all of a sudden you felt like that quality wasn't there,
Right.
right? You are looking to maintain that life quality.
Right.
And testosterone in males can actually start decreasing as early as their mid-20s.
Right.
And after 30, it's about a 1% gradual decline per year as much.
30. So I thought 40, 45, it
Yes.
started about 1, but you can start at 30.
Absolutely.
Yeah.
And, 1 in 3 men over the age of 45 have low testosterone on their labs.
And I think the important thing here is gradual, right? I think
Yes.
like in my line of work, people will be like menopause, which is a punny name for andropause. And they try to compare it to menopause, which we'll get to in a second. But andropause happens so slowly, right? And so it's sort of like the frog in the pot of water, right? Like you don't really know it's happening until it's happened.
Yeah.
It's a very gradual decline. And I think that's why it's also subtle, because
Yeah.
it can just start off as mood changes, maybe some irritability, maybe just fatigue, right?
Right.
And you might think, I'm just having a hard day.
Yeah.
Maybe I'm just getting older.
Right.
Everyone's tired, right? And maybe it just slowly creeps up on you. And then eventually you start noticing, wow, this is really different than my baseline. I'm not able to do that 1 hour of strength training that I was doing. I'm getting tired in between. I'm
Yeah.
needing a break, right? Or when it gets more severe, you might have other symptoms that might manifest, like even breast enlargement, soreness, tenderness, or loss of body hair, decrease in the amount that you're shaving. And these
ED is the big one.
ED is a big one, decreased sex drive. So these are things that you might start seeing and noticing, which may be more apparent. Now, menopause is a little bit different when it comes to that. So females also can start having declining estrogen and perimenopausal symptoms by the age of 35 or their mid-30s. But when they start losing estrogen, they go to a depletion of estrogen, very, very low estrogen levels when it comes to menopause, and they don't have a menstrual cycle for 1 year. With men, it's not that their testosterone reserve will be guaranteed depleted,
Right.
but it will gradually get lower.
Right.
And you may fall into the criteria of having multiple low testosterone ratings, but it's not just about numbers, right? It's about your symptoms. So you have to have low testosterone levels on labs, but you also need to have symptoms that are affecting your life quality and function. And that's what would really qualify you for guiding your treatment options.
Right.
So what did you decide to do about it? So you realize that you are feeling this way, you're not going to take it. Who do you call?
I called a buddy of mine who's a doctor.
You didn't call me?
Who's a,
You didn't call me?
I don't know how
He's
I
a
like about
doctor
this.
in-
Oh, okay.
I'm going to call you later.
Next time.
Who's a doctor in Santa Monica. His name is Rand McLean. And have you ever heard of Rand? He deals with a lot of high-profile people, athletes and actors in LA. And I went in and we did some bloods, and sure enough, my testosterone levels were extremely low. And he said to me, it's amazing that you've been able to maintain the level of intensity that you are with those testosterone levels. And there were some other things too that he was like, okay, we can improve on this and this. And there was some, vitamins that he wanted me to increase. Vitamin D is so important. It's almost hormonal. Right. And so through that, he prescribed me testosterone. I got to say, within about a 6-week period, I noticed extraordinary changes.
What's going on? Like what's changing?
My workouts, I felt like I was 35 years old again.
There you go.
I was sleeping better. My moods were incredibly improved. Sex. I never really, really felt a problem with my sex drive, but I felt an improvement.
Sure.
And just an overall general health felt better. And, it's interesting because I'm vocal about it. I'm like, yeah, I'd say testosterone, and people are like, oh, that's cheating. I'm like, I'm not a linebacker for the New York Giants. Right. I'm not an Olympic wrestler. I'm not cheating at anything except cheating getting older.
Yeah. And you've talked about this a lot. A lot of your contemporaries don't talk about it.
They all take it.
Well, I think that's a larger conversation. I also take testosterone.
Yeah.
And whenever I tell people, they are sort of taken aback that A, that I'm talking about it, or B, that I admit it. And so certainly in Hollywood and popular cultures, there is this stigma around it. With
I don't know why.
Low testosterone
Yeah.
equaling what? Softness, weakness, oldness, elderly.
Aging.
It's aging.
Right.
But it's so funny because why is aging so taboo?
Right.
It's not like just some of us are doing
Right.
it.
Well, it's better than the alternative, right?
Yeah. We're all doing it, and it's how you want to go about it. You know what I mean? I read and listen to everything about anti-aging, about how to create a better quality of life. I don't want to look like I'm 25. I just want to feel like I'm 25. And if I can find the avenues to making me feel that much better, why would I not do that?
Yeah.
Do you know what I mean?
I mean, I wish more people talked about it.
And I would agree. I think it's highly stigmatized against. I really appreciate you actually, Frank, for being so open and talking about it, because I think people will look up to you, and it may propel them to walk into my office and say, you know what, I really haven't been feeling like myself, right? And I would like you to check my hormonal panel or see if we can do a proper evaluation to see what's the root cause, right? And I think sometimes people need to see an example in order to get a little bit of courage to admit that yes, maybe I need to go and get evaluated, right? And it's not just about, Vanity or, sure, we all want to be like Frank and look 25 and feel like we're 25, right?
I wish Frank looked 25.
It's a sleep piece of it, the
Right.
mood piece. Like it's not about what you look like, it's how you feel.
But it's also
right?
about your health, right?
Right.
And if you have a treatable hormonal condition, you should absolutely treat it.
Yeah, and you talked about, lack of bone density and things like that. I mean, that's a real thing as you age, and it's preventable.
Yes.
Or we can slow it down at least. And, by lifting heavy weights and by, testosterone treatments and things like this, you'd be so impressed if I took my shirt off right now. No, I'm kidding. But seriously,
We're already impressed.
I still maintain a level of body mass and quality muscle on my body that, when my father was 60, I mean, he looked 60.
Right.
Do you know what I mean?
Well,
And
there's
so-
like the whole like cocoon meme that goes around when it's like all the people in the cocoon were like in their early 50s and they're
Right.
the same age as
Yeah,
like
yeah.
J-Lo, and you're like, what happened?
I
Like,
know,
what?
well-
And that's like it's like 2 generations later.
Yeah, it's crazy. It's crazy. And why wouldn't you want that for yourself? Isn't that what we're trying to do, is kind of prolong the quality of life that we have?
Yeah.
And I think that's why we're here. We want to have conversations about
Right.
it, but cycling back to also your point about just your body composition, right? So that can also be affected by hormones, right? And as we're aging and our hormones are changing, whether it's in men or women, you start getting more predisposed to metabolic disorders, right? Whether that's insulin resistance, prediabetes, diabetes, high cholesterol, all of these things start unraveling. And as we're aging, men and women, we're all losing lean muscle mass. And so everything you just talked about, your history of being an athlete, doing jujitsu, boxing, strength training, we know that we have guidelines out from societies that recommend, for example, American Heart Association recommends that you do strength training twice a week,
Right.
at least. And when people are even coming in for, deficiencies in hormones, we talk about not only medication therapy, but a comprehensive outlet, right? You want to make sure you're talking to them about the importance of your protein intake, your fiber intake, getting that nutrients dense diet, going to the boxing class, doing some free weights, get on the floor doing some push-ups, right? And really why that's important.
Yeah, and you build the armor around your joints, and as men get older, you see that classic, they call it a dad bod, where the arms get really, your legs
We just
get
call that
very,
a body here.
Right,
at Men's Health.
Yeah, you get thin legs and thin arms, and your chest starts to sag, and it's like, before you know it, it's like you're in trouble. You are in trouble, and then you're prone to injury. You're prone to other disease, and I don't want that. Like I want any part of that. So I take testosterone once a week. One little dose cc, and
Do you feel it tapering off at the end?
I don't.
You don't.
I never do. I do get excited on Fridays when I have to shoot
That's
my
your day.
testosterone.
Yeah,
It's
it's
my
your
day.
day.
It's like, come on, I got my shot. And
Yes.
it's great. And I also do peptides.
Yeah.
Or recent kind
Yeah.
of discovery, and hair, nails, all that kind of stuff doesn't stop growing. It's kind of cool.
So one of the interesting things about being tested for testosterone when you're especially on your undergoing therapy is that they also test for estrogen.
Yeah.
So talk a little bit about how estrogen is impacted, estrogen production and sort of how it manifests when you're on testosterone therapy.
For all of these hormones, like I said, they have an interplay, right?
Right.
So even estrogen in males is going to have an interplay with their mood, with their motivation, with their energy, with their bone density, all of these things, right? So we also want to check those hormones as well, and they're all related to each other.
Right.
And there's also other things which are intermixed that can affect these hormones, right? Like, for example, your protein levels,
Sure.
right? Binding globulin, all of these kind of nuanced, complex things that we see on blood work. So we always do a comprehensive panel, but we also check other hormones to make sure that there aren't any secondary causes, right? So we also may check a prolactin level,
Right.
which is another hormone, which is quintessentially thought of as, a hormone more important in females, right? For breast milk production, things like that. But we can also check that in men to see if it's affecting their testosterone. We may also check their thyroid levels to make sure that there's nothing affecting the testosterone. So we often check a slew of other hormones
And
to
it's
make
super
sure.
important to understand, you can't just get a testosterone test and get the results back and know what to do, right? You need to have the whole ecosystem, the whole context
Yes.
to understand the path forward.
Yes, because there may be other things even besides other hormones which may be affecting your testosterone
Yeah,
levels.
yeah.
Like, for example, individuals who are living with overweight or obesity or type 2 diabetes, they have a 30 to 50% increased risk of developing hypogonadism or low testosterone levels, right? So other disease processes can also affect your testosterone levels. Medications can also affect your testosterone levels, right? So there are so many other things in the environment, even high stress can affect your testosterone levels.
Right.
So there are many other things which need a proper workup to see why those testosterone levels may be low. And some of them are potentially reversible causes. You may not need treatment therapy through testosterone. You may have some other things you can work on in that case as well.
One of the things that I think is interesting is the wide range of what's considered normal when it comes to testosterone. And I think this is the conversation that guys who are thinking about this have both amongst themselves. And they're like, I'm not technically low, but I'm on the lower end.
Yeah.
And I kind of want to be on the higher end, right? Like you're still in the window.
Yeah.
One, why is it so wide? Is it just to account for like different biological, makeups? But also, how should men be thinking about that when they get the results back, as far as like low normal, high normal, that whole spectrum?
Yeah, so that's actually great. And you guys mentioned this in the beginning a little bit too. So the range is very wide. So oftentimes I have men coming in with this concern that, why is mine 450 and somebody else is 600?
Totally.
Right? And if you look at different lab values when you get the test, the ranges can differ a little bit, but generally it's about 300 to 1,000 nanograms per deciliter. That's a wide range, right? And it's really about, again, personalization and what is normal for you. So let's say you're quintessentially around 450 and you start seeing a gradual decline. That's fine if you feel okay, right? And if you don't go under a level that we think is suboptimal, right? And you're having symptoms. But again, it's individual to what is optimal for you.
And it's really about the symptoms, which is so interesting.
Yes.
Like if you're doing fine,
then you're
450
fine.
or even low, like God bless, have fun.
Yes, absolutely. So like I said, it's just not about the numbers, right? It's about how you're feeling. It's about the symptoms. So the symptoms and the numbers together have to correlate to kind of drive your treatment, right? And if it's actually affecting you. If you're sitting at 400 and you feel perfectly fine, I don't need to do anything.
So I love that because it doesn't imply a deficiency.
Absolutely.
Right? It's like there's nothing wrong with you for being at 400 and you're fine, right? But if you're at 400 and you're not sleeping and you're in a terrible mood and you're losing hair and losing muscle mass, like then you could benefit from a little bit more.
And on the flip side, you may be at 700 and not feeling well. Right? And so what do we do in that case? Well, maybe it's not the testosterone. We'll repeat labs. We'll see if there's anything, all those other hormones that we were talking about, look at secondary causes, and we got to figure out the root cause. Right? So I really hope one thing from today that people can gather is really, even if your testosterone levels are high and you're not feeling well, you should go to your doctor and ask them, depending on your symptom, what else they could look at. Maybe it's not your testosterone levels.
There's also this stigma, and maybe it's generational, but in my generation, first of all, testosterone is steroids, right? And so steroids is, it connotes a very certain thing. It's a guy in a gym, in a bodybuilding gym,
anabolic steroids,
which is ridiculous, right?
Stallone, not that he was on steroids, but you picture Sylvester Stallone, right?
You picture Arnold Schwarzenegger. Not even Stallone, it's Arnold Schwarzenegger. That's that generation, right? That's what it is. And the other thing is, I'll say to guys, they'll tell me about how they're feeling. You can't believe how many people reach out to me about this subject, right? And so I'll say, this, that, and the third, and they go, no, my testosterone's fine. And I go, well, it's not about whether you think your testosterone is fine. It's not making you less of a man.
Correct.
So there's a lot of still stigmas attached to the word testosterone that I think we need to kind of break through.
We should all say it 3 times every day, right?
Testosterone. I love it.
Exactly.
I love it. I love it.
And Arnold Schwarzenegger will appear in the mirror. Testosterone replacement therapy, it's a pretty rudimentary intervention, right? You got a needle, and sometimes there's a gel, but like it's typically an injection.
And in men, it could even, I think now they have a pill.
Absolutely.
So talk to me about some of the innovations on your way at NYU Langone Health. You guys see like the most cutting edge stuff. What is entering the chat as far as it relates to that type of intervention?
Yes, you're absolutely right. There are some oral formulations. There are injectables. There are injectables that actually require less frequency of dosing.
Oh, okay.
So you can go longer intervals without having to dose more frequently. There's patches, right? There's also nasal gels, right? So there's a lot.
There's little balls that you
Pellets.
pellets that you
Right.
could stick under your that people have.
Oh, and it's like a slow release type
Yeah.
thing? Oh,
So
cool.
that one, I would say, for any of these formulations, you really need to make sure you're speaking to a board-certified
Yes,
doctor
always.
and making sure that they're an expert in that field and what formulation they think is right for you. Because you're going to hear about a lot of things potentially in the media, which may not be the most optimal option for you.
Yeah.
Right? So you want to make sure you're going to a doctor who is very well versed in this. And so that would be, a series of formulations that you have. And you want to make sure that they're choosing the correct one for you, but also that you're okay with the one that you're administering to yourself.
So absolutely. Now you could be on an Instagram and if you scroll through, you'll see that they're offering a testosterone treatment that you could get through the mail service.
Yeah.
And I've had a couple of people do that and they had bad results, and I would suggest you not do that and then go to a doctor and have it done the right way.
Any medication doesn't come without risk.
Sure.
Right? And you need to be appropriately monitored. So I'm sure even in your journeys in the beginning, your doctor must have said, why don't you come in 3 months and we're going to check your levels again. We're also going to check some other markers that we're watching out for: your hemoglobin, your hematocrit, your red blood cell count, your PSA score, your cholesterol, your liver enzymes. So there's so many things that need to be followed in the beginning, because it's always about risk and benefit and your safety, right? So we want to help not only treat your health condition, but make sure you're doing well.
That's right. That's right. My Dr. Rand, I've been a patient of his for years. And when it's time for me to do my bloods, if I'm not there, he will not prescribe.
Cut it off?
Yes.
Yep. And I appreciate that.
We did a story last year on men who were combining GLP-1s and testosterone as a way of cutting fat and increasing muscle at the same time.
Right.
And I would also not recommend. No physician's going to do that for you, correct? And it's just not.
Right.
Stay off the internet when it comes to stuff like that.
Absolutely.
So actually things are pretty ever evolving, right? So living with obesity and overweight, like we had talked about earlier, can actually lower your testosterone levels potentially. If you do focus on weight management, if that's something that's needed, it can actually help raise your testosterone levels. So there is some conjecture about using GLP-1s in patients who are living with overweight and obesity who may have lower testosterone levels to see what that does
makes total sense,
to that
right?
testosterone level. But I would say, again, like we were mentioning, you want to make sure you're being monitored.
Right.
You don't want to get both of those agents somewhere recreationally where you're not being monitored, you're not being supervised, you're not being counseled. That could be very dangerous.
Yeah.
So it's very important to always get FDA-approved drugs and make sure you're also at a doctor's office.
From a real doctor.
From a real doctor.
And I'll just to add on to that, I work a lot in Atlanta, and there's a lot of these guys pop up at these storefronts, and they're administering testosterone and peptides and other things, and it's kind of like they look like they're medical facilities, and so I bought a couple of things to test out to see if it was legit, and sure enough, we had a third party lab do it, and it was no good.
Yeah.
And that's a dangerous thing to be shooting intramuscularly, some substance that just so you can save some dough.
Yeah.
Right.
So I would be really careful.
Yeah, absolutely. I tell people, you have, for example, Chanel. And then you have Canal Street Chanel, right? And if that's okay, if you want to carry that, but it's external on your body, right? When we're talking about medications, you don't want to be injecting something that is not FDA approved, doesn't have the same clearance, doesn't have the same safety regulations into your body, because you might be exchanging a few quick bucks for years of your health, right? And we never want to do that.
No.
So I want to pivot and talk a lot more about the female experience with hormone change. Over the past few years, we've seen a surge in education and awareness around both menopause and perimenopause. There's these memes going around of sort of 40-year-old women being like, I'd never heard of perimenopause until a few years ago. And there are more and more resources going to helping women not only understand what's happening to them, but what they can do about it. So I want to start with perimenopause. We are joined now by best-selling author of The Let Them Theory and the host of the Mel Robbins podcast, Mel Robbins herself. Thank you so much for joining us. Dr. Jaisinghani and I have just been speaking and talking about all these hormone changes that are happening in midlife. And you've been so generous with sharing your experience And so I wanna take a little trip in the Wayback Machine to maybe 10, 15 years ago when you started to notice that you weren't sleeping so well and you were feeling a little under the weather and maybe there were some changes in your weight. Do you remember when those changes first started to happen?
I don't exactly remember, and I'll tell you why. The reason why I don't remember is that until recently, nobody has been talking about this in public. As educated as I am, I went to an Ivy League college. I have a law degree. I have written a number of best-selling books. I don't say that to brag. I say that to say I didn't know what perimenopause or menopause was. When you're in your 40s, man, you're starting to hit like some of the prime years. When you're in your 50s, like things are getting amazing.
Yeah.
That's not when you think that you're old. That's not when you think that you're going to slow down. And so there were times where I would walk into the kitchen in my 40s and I would go, wait, why did I walk in here? And then I think, oh, is this dementia?
Right.
Am I losing my mind? Like, did I have too much Chardonnay last night? What is happening?
The two key words, right, are perimenopause and menopause, as Mel said, until like 18 months ago, no one was talking about either. So can we just do like a quick definition check on like what they are, what the difference between them is, and like what the lived experience is like so that people can be like, oh, like maybe this is what's happening to me.
Sure. So Mel actually told us a great trajectory of what can happen. And, menopause is something that all women experience. It's a critical health transition point, and most women fall into ages 45 to 55 when they're going through this. The average age in the United States is about 51 years of age. And at this time, this is when your ovaries stop producing eggs. And those hormone levels like estrogen start becoming very, very low. And you stop having a menstrual cycle. And what most women don't realize is that if the average age is 51, your symptoms in that transition phase can start a decade earlier. And so that can be mid to late 30s.
And that's perimenopause.
Correct. And you can have all of the symptoms. You can have none of the symptoms. You can have subtle symptoms. It can be heavier period, lighter period, no period, very frequent period, hot flashes, hair changes, skin changes, everything from the gamut of something to nothing.
Here are the top 3 symptoms. I am starting to experience a lot of brain fog. Like I just don't feel like I'm as sharp as I used to be. I don't know what's going on. And then I would be told, well, you're under a lot of stress and you got a really big job. And, that's really understandable. And I'd be like, yeah, and I feel like a Twinkie on legs because my entire middle section, I'm like a giant sort of like rectangle walking around, and it doesn't matter how clean I eat. It doesn't matter how much I exercise. It's not only that nothing's working, it's getting worse. I'm putting on weight. I feel bloated. I don't feel like I'm in my body. And then the other big one, other than like the hot flashes, was I'm like as dry as the Sahara Desert. I mean, I used to wipe bag balm all over my kids when they had a diaper rash. I now carry that stuff in my purse. What the heck is going on? And so they would literally kind of bounce around. Well, I don't know, but there was no recommendation for what to do. You may be coming in to menopause. This could be, but there was nothing to do other than rest. And so I just kept pushing through.
Women go through the postmenopausal phase for about 40% of their life. And we're not talking about it.
Right.
And
we're not preparing for it.
Right.
Women are not preparing for it.
No, we're not preparing for it.
I actually think it's scarier than that. It's scarier than that because what we're only now starting to understand is how this change in a woman's body and the fact that you're going to live for decades longer actually has a direct connection to heart disease, to issues with bone health, to dementia. And so I feel like this is a medical issue because your body is designed to work with estrogen and progesterone, and when you remove it, things deteriorate. And we now have the research to prove it, that it's beyond longevity and feeling great and memory and being able to enjoy your life. It's actually your ability to live longer because of the health outcomes associated with you not addressing this deficit in some way that's safe for you.
People forget that menopause, postmenopause, the number one killer of women is cardiovascular disease. We need to think about menopause care as not only taking back time and reversing it, but rather preventing more disease processes for women so, they can live longer and live better.
So Mel, all this was sort of happening as you were becoming Mel Robbins, capital M, capital R, right? Like you were, there was when you first published your book, it was when you were launching a podcast and the speaking. I'm curious whether your experience at the time, as far as what was happening in your body and your mind and your relationships in your life, do you see any influence on your work and your messaging and the what you wanted your audience and your followers to take away from what you were saying?
It's a great question. So I would say in the late 40s until about 52, I was so focused on doing speeches at big corporate events and paying off, our debt and go, that I was in a mode of just pushing through. It wasn't until I decided that I was going to launch the podcast. And that was when I was 50, how old? I think I was 54 years old when I launched the podcast. And of course, I turn every interview into my own personal medical appointment. You don't necessarily hear that. I'm like, so I have a bunch of questions for you. And that's when I started to connect the dots. And the second I thought, wait a minute, if I've never heard it explained this simply so that I really understand it, I bet a lot of people haven't.
Yeah. Is it strange? Can I ask that? Is it strange talking about this with a guy?
Rich, I think it's amazing that I'm talking about this with you, a guy, because menopause is hitting the female body, but it affects everybody.
Right.
I mean, don't we want men and boys and everyone to understand that 100% of the women in your life are going to go through a life-changing medical condition that they cannot avoid, that will impact their mood, their sleep, their ability to focus. It will impact their joints, their muscle density. And once they go through it, if they don't make changes to their lifestyle or they don't seek evidence-based medical help, their health outcomes in terms of cardiovascular disease, in terms of bone density, plummet. Because a woman's body is not like yours, Rich.
Right.
My body has receptors in every organ that require and are looking for estrogen in order for my brain to run and my muscles to run. I didn't even understand this until 2 years ago.
Right.
And so I love that you know this.
Right. And
I
wouldn't
love
it be
that my
so
husband knows
refreshing
this.
if you were with a coworker or something, and just as if you were I pulled a muscle in my arm or something weird is going on, you're actually I'm going through something hormonal and this is happening, and it's not a thing, right? It doesn't have to be a thing.
Yeah, it's a thing, and things that we don't talk about become big things that we feel a lot of shame
Right.
and disempowerment around.
Right.
And the fact is, this is so normal. This is
It's
part
so
of
there
a
couldn't
woman's
be more
life.
normal. Yeah.
It couldn't be more normal. And so having the language, having understanding for all genders, having people truly understand that this is a change in a woman's body that impacts every single aspect of how her body works. It's awesome that you're here. It's awesome that you're interested. It's awesome that you're a part of the conversation. I'd like all men to be involved in this because it impacts every single woman that you care about.
Right.
I love that. Then you can be like, my wife isn't a bitch. She's just going through menopause.
Those are words to live by. Mel Robbins, thank you so much for taking the time. I loved listening to Mel. I mean, I always love listening to Mel Robbins, but she's just so candid and honest and generous with her experience. And I think the more that people talk about it the way that she talks about it, the more access we'll have to honest and open conversations.
Absolutely. We need conversation starters. And I think we need everybody involved. I think she's absolutely correct in saying that many of us have probably suffered in silence. And I think we're changing that conversation. I think menopause care is in a new era.
Yeah.
And I think we all need to be involved. And I think it's really important to go into a doctor again and talk about what's the appropriate treatment for you. right? There are some non-hormonal therapies, but there are also hormonal therapies.
Right. And lifestyle changes.
And lifestyle changes, always. I think the foundation
So
for
important.
health,
Yeah.
lifestyle changes.
Yeah.
Nutrient-dense diets, you have to talk about exercise, but then there's other things. Stress reduction. How easy is it to just tell people, don't stress?
Right. Stop worrying.
Stress every day. We stress
Right.
about everything, right? So what can we do?
We stress about how much protein we eat and
Right.
how much fiber we're
how
getting.
many macros we have to count every day. Even that's stressful, right?
Right.
So we need to tailor our gaze on what's really most important and kind of prioritize, or things that people don't really talk about, like sleep. I think you were mentioning sleep,
oh my
right?
goodness, yeah, so important. Almost on a hormonal level as well.
Absolutely. So many women also face a lot of sleep disturbances. Like you said, waking up at 3 o'clock, staring at the ceiling, don't know why. That's a problem. I can fall asleep, can't stay asleep, right? And it's not just about the quantity of time that you're sleeping. It's really, again, about that quality. Both matter. How many times have you been to the doctor's office and someone's talked to you about sleep? Right? So again, we need to do better, but I also like telling the community about this because I want them to go and ask their doctor, hey, I'm not sleeping well. What do you think is going on? And then maybe their hormones can be investigated to see what's happening, right? But for perimenopause, it's not necessary that if your hormones don't show that there's an abnormality that you're not potentially going through that phase. For menopause, it's also a clinical diagnosis.
Right.
A little bit different, right? For men, you need that blood test that shows an early morning testosterone that's low, multiple times. And the symptoms for females, you're going to see it's more of a clinical diagnosis where
That's for menopause. Whereas perimenopause, you might get
Yes.
normal labs back.
you might. Right. And that doesn't mean you're not in perimenopause, right? If you're having the symptoms. Again, we talked about this very similar to men. It's not just about that one number. It's not just about that one lab value. It's actually what's happening to the person who's sitting in front of you, right? So we need to take that into context. And for menopause, it's a clinical diagnosis. So if someone doesn't have a period for 12 months, they're postmenopausal.
Right. So just getting back to one final question about perimenopause. So a woman, 40-year-old woman, labs come back, totally checked out, normal. They have all these symptoms. A doctor might say, you're fine.
Yeah.
And as we've seen historically, they might say, maybe go see a psychiatrist, or maybe it's all in your head. Some doctors will be like, well, they'll say the things you're saying, like maybe this is perimenopause. How can a patient advocate for herself in that situation so she's really being seen and heard?
An endocrinologist is a hormone doctor, so that's usually a good place to start. But you also want to see and ask your doctor what they feel comfortable treating, right? Nowadays, fields have become super subspecialized. Someone might say, I only do diabetes. I only take care of the thyroid. And someone may say, I'm not very good with treating perimenopause, menopause. So you want to make sure your doctor is an expert in the field that you're going to. So look them up, look up their credentials.
So it's great to have a
they train.
PCP and it's great to have an OBGYN,
Yes.
but you really want to go to a specialist.
Yeah, I would say, going to a gynecologist and endocrinologist is usually very important. You can also go to a primary care doctor who feels that, they have enough experience in managing this condition, right? So you want to make sure you're checking out and asking the doctor, are you comfortable treating this? And how, do you have your expertise in this? That's a good way to start. Second thing is you want to do your research, right? Obviously, you want to look at not only lifestyle changes, there are also non-hormonal therapies which can help. There are obviously also supplements on the market, but there are also hormonal treatments which can help you. So it's, again, you need to advocate for yourself. You need to be at the right place at the right time.
My ex went through menopause, and now she's on testosterone and peptides. They have her on.
Yes. So this is something that's changed, right? I think there's been a fear from hormone replacement therapy, right? And especially from the Women's Health Initiative studies that came out in the early 2000s. And it's been 20 years, and it's taken a lot of nuanced science, a lot of community guidelines to come out and say, for most women who are menopausal, average age, hormone replacement therapy is safe and it's effective. For most people, the risk is small and the potential benefit is substantial.
Right.
But that's taken a lot of time. And
It's like there's an
also,
entire generation, if not more, who sort of suffered through, I guess, a misunderstanding or
Yes.
bad data.
absolutely. And we had to relook at that data.
Right.
And we still have people pushing forward to advocate for people, even women, getting treated with testosterone therapy, right? Because back in the day, it used to be testosterone therapy. We don't do that for women. It's not recommended. It's not advised. Now we have different community guidelines, different data that shows that testosterone also plays an important role in certain situations for females. But again, you need to go and get evaluated. You need to see if you're a good candidate for that treatment therapy.
Right. So a patient who, say she's 51, the average age of going into menopause, what are some questions she should be asking her doctor about the path forward? Maybe they're not questions that previous generations had asked, but it's the stuff that she really needs to know to weather this transition and come out sort of whole on the other side.
Yeah. If someone told me what I wished I had done post my 20s, I would have said I wanted intentional, targeted lifestyle changes. Okay. We know that estrogen also, while it's wearing up, it's going to affect your muscle mass. It's going to affect your basal metabolic rate, your metabolism, your bone strength, your longevity. I wish there were targeted interventions, right? So I want my patients to go in and ask about, how should I be structuring my diet? What should I be focusing on? How should I be changing my exercise regimen, right? I wish more people were advocating for strength training and not just that cardio culture.
We're trying a women's health,
right?
We're trying.
It's that cardio culture that comes up. Everyone wants to be on the treadmill and I'm like, no, we got to do free weights. We got to do, resistance bands. And then again, just asking about, when do you think is the correct time for me to start HRT if that's something you're interested in, right? And sometimes, guidelines are guidelines, but that's the funny thing about guidelines, right? They're just there as a scaffold. Sometimes it's about what you and the patient want to do together, right? And that's why, again, it's very individualized care.
At what age should women start thinking about this? I mean,
early,
like ASAP.
In their 30s,
okay,
early 30s, even entering your 30s, I would start changing everything. Right. And honestly, you're never too young to be making lifestyle changes. If you're making them in your 20s, that's not bad.
And it's also not just about menopause, it's about
your overall health,
life. Yeah.
right? So you want to go in prepared. And I think many of us don't go in prepared. It's especially as a female, people get very scared about strength training. They're like, I can't go into the gym.
I don't want to look like
all
a
the
guy.
gym bros are in there. They're lugging around that, big water tumbler and I don't know what I'm doing in there and I need help, right? And so we really need, again, some advocates that are there where patients feel that it's relatable, right? And that's why, again, Frank, thank you for supporting the cause for hormone health.
Yeah, I mean, it's just an interesting thing that has been developing over the past, I want to say 5 years, where hormone therapy is becoming more accepted and less taboo. But I have to tell you, just on social media, if I post a picture of me in the gym with my shirt off boxing or something, it's like, oh yeah, but you're doing this and that. I'm like, yeah. Exactly right. That's exactly why I'm
look at me.
That's why I can do this. It's like, but you're cheating. It's a shortcut. I'm like, it's a shortcut for what? To be better? I'm not,
I think that's the bias and the stigma talking, right? I don't think there's a shortcut when it comes to your health. I think you can probably attest to this. Your abs were not built in one day of going to the gym. You didn't walk out and come out with a six pack, right? You did the same thing over and over for hours consistently.
My abs are a byproduct of my lifestyle, right? And so, like I'll also say, maybe I'll eat a piece of filet, a grass-fed filet, and an avocado, and some raw cheese and some organic eggs, and that's my meal for the day, right? And people say, "Yeah, but you're not living life." I'm like, what is your thought process? That's exactly what I'm doing. It's a high protein, a high good fat diet. It's making me live my life, right?
Yeah, but we see that, right? That fad culture creeps in. Everyone thinks it's cool when you're in Manhattan to go to 4 happy hours and have 4 drinks every time you're there, right? And then I see a lot of young men and young females coming in and they're like, I actually didn't realize I'm consuming this much alcohol. Yeah. Alcohol also affects your hormones.
Right.
It affects your sleep.
In a big way.
It affects so many things, right? So sometimes we see people kind of just following the crowd or following what the cultural norm is, right? And again, I think it's important to kind of reset that. This is about structuring what your health should look like for you, right? What works for somebody else may not work for you. And that's why you need to pay close attention to how you're really feeling.
I think we touched upon something that we hadn't mentioned. Alcohol and testosterone therapy is not a good combination. Right. It's really not. I stopped drinking almost 3 years ago. And
congratulations.
And I wasn't a fall down raging alcoholic, but I did drink a lot of wine. I did. Like, I'm an Italian guy who likes wine. And, I drank every day. I drank a few glasses of wine every day and not thinking that it was affecting me. Yeah. And, boy, I got to tell you, when I stopped, along with the testosterone therapy, I can't tell you how much energy, how great I feel, it just all came together for me. So there's a lot of things that you're mentioning and people say, well, how would I go out if I don't drink? I'm like, well, you have to decide what you want your life to be.
Right. What's important to you.
Is it, do you need to get drunk 5 times a week in order to be social?
Right.
Or do you want to feel good?
Yeah.
You know?
Yeah, exactly. And I think we kind of realize also through time, alcohol in high consumption or even moderate consumption, right? It's a toxin, right? Eventually, it's going to affect a lot of different things downstream. And everybody's different. Maybe, you could be okay having 1 or 2 drinks. And maybe as you're going through time, that 1 or 2 drinks is not okay anymore. Now it's disturbing your sleep. It's causing you other symptoms. And that's why it's important to kind of notice that. I think also, people often come and say, I can't, open up in a social setting if I don't have alcohol present, right? Or they may say, well, everybody else is drinking. What am I going to do, right? And again, it's about kind of feeling comfortable in your own space, but also you may enable and advocate for someone else to kind of join your journey.
Right.
Yeah.
Right. And now there's plenty of resources, plenty of people talking about this. And I think it's great to see those changes happening.
I feel a consciousness that's been kind of developing.
Well, it's sort of, as you said, it's sort of seeped into the lifestyle. I think these are sort of simple lifestyle changes, not easy, but simple. One of the things that we hear a lot about in the media is like the explosion in like femtech, which I hate that word, but it's this idea of a lot of innovation in the perimenopause and the menopause space. What's exciting about, what are you seeing out on the horizon as far as new products, new research, new tools to help women understand and act on these stages of life?
Yeah, I'm loving seeing podcasts like this. I'm loving seeing media outlets talking about perimenopause, menopause, men's hormonal health. I'm also loving seeing the development in technology, right? Yeah. So now I have patients who come in and say, Dr. J, I can't afford a personal trainer. I'm not going to the gym, but I really want to work out in my house. What can I do? Well, now you have apps that have AI-driven workouts.
Great ones.
Great ones.
Really great
right?
ones. Really
They're
developed.
not as good as Men's Health if anyone's asking.
No, they're not, but
fine.
they're highly developed.
Yes, and they're getting more and more developed. And I think sometimes it's great to have a resource, right? People are also using a lot of wearables, other things which, monitor and help track, because how much are you going to track? Right. So sometimes if something is simplified into one arena, it might help alleviate some of that burden of constantly having to measure and track
cycle
something.
Tracking and
Absolutely. And there are a lot of institutions that are also advocating for a push on women's health as well, and I think that's very, very important because quintessentially in a lot of our studies, I don't think women have been as well studied in many disease processes. Yeah. And so now, kind of focusing a little bit more on that when it comes to research, I think is also super important.
Right. All right. Well, brighter days ahead for all of us. Thank you so much for joining us.
Yeah, thank you for having me.
And enjoy your day, everybody. Thanks.
Yeah.